All right, so today I am going to be establishing the subcut line in my patient, Rupinder Appendi. So first things first, I want to just look at my doctor's order, my MAR, and make sure that everything's transcribed properly and that I know who I'm looking for and what I'm doing, and then I'm going to go into the client's room and get them to introduce themselves, and then we're just going to have a conversation about what we're doing, and I'll do some assessments. So first things first, my doctor's order sheet says it's Rupinder Appendi, and my MAR says Rupinder Appendi. The doctor is Dr. Jensen on the order and Dr. Jensen on the MAR. We have room 319 on the order, 319 on the MAR. His date of birth is October 1st, 1982 on the MAR, or on the doctor's order, and then on the MAR, it's October 1st, 1982. I am noticing on the order and on the MAR that there's an allergy. So I'm just gonna, on my little cheat sheet that I take into the room, I'll just write down that he has an allergy, and I just want to confirm with him in the room and ask him what that allergy is. So then as far as the drug order, today we're going to be doing his PRN morphine. So I am making note that he has other drugs that he's given throughout the day. I have made note of when in my shift I would give them, but for the purpose of this testing, we're doing the morphine, so that's what we're going to check. So his morphine is 3 to 5 milligrams by IV or subcut, Q2 hours, PRN, may insert a subcut line. So today we're going to be doing that subcut line insertion, so that's how we'll be giving his morphine. So that's on the order sheet. So I'm just going to go over to my MAR, and we have it ordered as morphine, 9.6 milligrams of a 10 milligram per ml dose. To prime the subcut line as needed, and then here it says morphine 3 to 5 milligrams is the actual order by IV or subcut Q2H PRN. So that order from the order sheet to the MAR matches, and then we're going to be doing it the 9.6 milligrams to prime that line. So upon going into my client's room, I want to assess his respiratory status, his level of consciousness, because it is a narcotic, and then we want to check his pain as well, and we want to know like where it is, when it happens, the intensity, how long, the frequency, and then we're just going to check on his allergy. So before I go into the room, I'm just going to give my hands a little wash, and I will take my MAR with me so that I can confirm, and my pen and my little sheet. All right. All right, so knock, knock, knock. Hello there, my name is Kendra. I'm your nurse for this morning. Could you please tell me your name? So he's going to tell me Rupinder Appendi. I got that by him verbally, and then he would have a wristband on, and on that wristband it would say Rupinder Appendi, and then I just want to ask him, Rupinder, what's your birth date? And he's going to tell me October 1st, 1982, and I would be looking at that from my MAR to my wristband by what he says, so that's 2 identifiers. I have the right person, and then by asking him those 2 questions, I'm assessing his level of consciousness, and then I could just ask him, Rupinder, do you know where you are today? And he's going to tell me, yes, I'm in the hospital. I just had my appendix out, so he knows where he is. He's alert ×3, so I can just say that here. And then I would want to be taking some vital signs, so I've hooked him up to his SpO2 checker, and it's good. He's sitting at a 98, so I don't have to worry about that. His vital signs, as far as his temperature, pulse, blood pressure, they were all in normal ranges, so I have nothing to worry about there. And Rupinder, do you have any allergies? And he's telling me he's allergic to peanuts, so that is a dietary issue, not so much my drug issue, but we are aware of it. So Rupinder, I'm just going to be going and preparing you a subcut line for your morphine, because I understand you're in some pain. And so now I'm going to get him to rate that on a scale of 1 to 10. Rupinder, can you tell me on a scale of 1 to 10, 1 being no pain, 10 being the worst pain ever, what you're at? And he's telling me he's at a 9, so like that's a pretty high pain. can you tell me where that pain is happening? And he's telling me it's on his left side. Left side? Is that where his appendix is? Left side. That's where his surgery was, where he had his appendix out, so that correlates. And how often does that happen? Well, he's telling me that it's like really intense right now. So that's not good. We're going to give him some morphine to take care of that. So we've done a pretty good pain assessment. We know that it's happening right now. It's intense and where it is. So we're going to give him some morphine to treat that. So I'm just going to be going and getting that ready, and I'll come in and I'm going to insert a needle with a little catheter to hook up a permanent, not permanent, but a temporary continuous line to give you your morphine so that we don't have to be poking you a million times to relieve your pain, okay? How does that sound? Are you okay with that? And he's okay with that, so he's compliant. We are good to do the procedure. What is happening to your computer?
I don't know.
Okay, we're good. Oh, we're good. All right, so now I am just going to go back to my med room to prepare. So we want to, I'll wash my hands again, just because I did touch his arm. All right. So I'm going to go into my med drawer, and we're going to go into our narcotics sheet, or into our narcotics section. Now, there is a narcotics sheet. It's in the other med drawer. We have the fake one, so we're just going to verbalize. So I'm going to need to sign out that I am taking out drugs. I also need to know how much the last person said there was to how much there is now. So on the sheet, it says that there should be 6 left, or 4 left, sorry. So I got 1, 2, 3, and 4, and I'm going to take this one out. So now I'm going to record that there's 3 vials left. So I have this. Now I need to do my first check to my MAR. We have morphine, 10 milligrams per ml, and here we have morphine, 10 milligrams per ml. So that's the right drug and the right dose. And we are giving it to Rupinder Appendi, and we're giving it by subcut line. It's a PRN, he's having pain, so we're giving it for the right reasons, to the right person, right time, right drug, right route. All right, so now I need to give my ampule a clean and break it. So, whoops. Okay, I'm just going to try that again. I didn't want to pull that out. All right, here we go. So now we'll just open it and clean it. And we want to make sure that, yeah, everything's out. So we'll give a nice clean and snap that right off. Straight into the sharps we go with that. All right. So now I'm going to take my 3 ml syringe as well as my blunt filtered tip because we are using an ampule. Screw that on. Just work this a little bit so it's easier. Remove. And I'm just going to draw up the full 1 ml, and then I will waste the rest after. I'm just going to cap so that I can get my bleb without spilling. And we got all the air up to the top. Okay, there we go. I see it up there. And we got 1 ml. All right, so now I'm just going to do another check here. We have morphine, 10 milligrams per ml. And then here we have morphine, 10 milligrams per ml. So we are still the right drug in here. Now I'm going to be making my label off of the ampule so that we have this for the line. It is January the 8th, 2020. and the medication is morphine. And then I'm going to be doing 10 milligrams per ml so that they know that that's the right concentration, because it does come in other forms. And then I will be signing my name. All right, so that's ready to go. Now I can do my third check from my label to my syringe. So we have morphine 10 milligrams per ml, and then we have morphine 10 milligrams per ml. All right, so now we can just make sure it's all the way. We will just wait 1 second on that to make sure we have it all, we're good with our second checks. I will need a second witness when it comes to wasting it, so we'll just keep that for a minute. We'll go out of the way. All right. Would my second nurse come and just check that I've taken this? So she came, she checked, she knew what I was doing, she signed for it. All right, now I have my line that I need to prime. All right. Screen went dark. All right, so now I will just prime the line. So I can see that my line is full now. And we have 0.4 mLs in the syringe left to waste. All right, so my second nurse saw me do this. She saw what I was going to waste. So now we are good to waste that. We're going to empty it and into the sharps, and into the sharps, into the sharps. All right, so now I have my line ready to go. I have my label, and we are good to go into the patient's room. I'm going to take my MAR, and then I'm going to take some gloves to protect myself, and some hand sanitizer, and my needle. All right, so we'll just give my hands a wash again. All right, so knock, knock, knock. Hello there, Rupinder. It's Kendra. I'm back again. We're going to do your morphine. Can you just tell me your name, please? So he's told me again, Rupinder Appendi, and your date of birth. October 1st, 1982. We still have the same patient. All right, so I have your needle here. We're going to put your line in and get you ready. We're going to go right here onto the back of, it would be more on the back of our arm, but this is where the pad is. So I would just want to do an assessment of his skin, just noting if there was any redness, bruising, scrapes, tattoos, lesions, anything like that, that would be an impairment for this procedure, but his skin is perfect, so there's nothing to worry about. And I'm just going to clean the area before I go in. All right, and we'll just let that dry. And in the meantime, we're going to wash again. All right, and I'm just going to get my bandages here ready. So there's one. Two. All right, and I will put some gloves on. So that area should be dry now. All right, Rupinder, I'm gonna poke you with a needle. The needle won't stain you, but a little plastic tip will, and that's how we're going to administer your drug. So you're just going to feel a little bit of a poke here. And I want to make sure that I have my bevel up. So, all right, I'm going to go in here and I'm going to pinch an inch and I'm going to go in at a 30-degree angle. All right, so imagine I'm pinching. There's no pinch here. All right, little bit of a poke here. And we're just going to go in all the way. Vanish. And that's good. All right, and now I'm going to hook up. Push that in, twist that to secure it. All right, and then I'm going to go here to attach this. Making sure the sight is in the window. And now I gotta try and get this thing off. Oh God. Have you ever seen? Okay. All right. Okay, that's on. Now we want to fully secure everything here. We'll move this little clamp up to the top, and we want to make sure that we have our label in here. What is happening?
I don't know what turned off.
Why does it keep going on?
Did you hit?
I swear.
Oh yeah,
Is it still going? Okay, it's still going. All right. Okay, so that is all good. That is nice and secure. That needs to go into sharps. So we can remove our gloves and throw them out. Now we want to wash my hands before I touch my pen. And we are going to document on the MAR that we established this on the, what did I say, it was the 8th of 2020. And we did it at 20:05. And the site is on the right arm. All right, so that is good to go. And then somebody else will be coming in and doing the dose.